Hello friends, welcome to all of you. Today we are going to discuss about hemoptysis. So let's start it. Simply saying coughing up of blood is called hemoptysis. It can be just little as blood tinged sputum or a massive bout of pure blood in your cough. In our country, very often happens that hemoptysis anyways diagnosed as pulmonary tuberculosis and given the treatment for the TB, which almost lasts for at least 6 months. But there are wide range of possibilities of diagnosis with the hemoptysis that should be kept in mind. Hemoptysis from above the vocal cords means throat, nose, it not actual hemoptysis, and it is called pseudohemoptysis. In true hemoptysis, blood always comes from below the vocal cords, that is from the airways or the lung parenchyma. One another symptom called hematemesis is also confusing with the hemoptysis, but it's different. Vomiting of blood is called hematemesis. These blood having acidic pH of stomach, but in hemoptysis it is alkaline. Hematemesis blood having dark red in color and contains food particles, while hemoptysis blood is fresh bright in color and contains alveolar macrophages. Hematemesis having associated gastric symptoms and followed by blood particle in stool called melena, but hemoptysis having respiratory symptoms and followed by rusty sputum production. Now let's see some causes of hemoptysis, true hemoptysis. Commonly lung infections with bacteria, viruses, tuberculosis, fungus or some parasites can cause this. Bronchitis, bronchiectasis can be the cause for hemoptysis. Diseases involving lung parenchyma like ILDs, sarcoidosis can cause it. Lung carcinoma or benign airway tumors can be the source behind the hemoptysis. Sometimes airway foreign bodies or very rarely pulmonary endometriosis can cause hemoptysis. Pulmonary hypertension, pulmonary embolism, pulmonary AV malformation, aortic aneurysm, endocarditis, mitral stenosis and much more. These are the cardiac causes that can cause hemoptysis. Direct trauma to the chest wall or some procedures leading to lung injury can cause hemoptysis. Some drugs can also cause hemoptysis. Anticoagulants and thrombolytics are very common among them. Diffuse alveolar hemorrhage caused by vasculitis, toxins, drugs, renal failure or some coagulopathy and connective tissue disorders can cause hemoptysis. Pseudohemoptysis, blood from nasopharynx or GI bleed can be aspirated sometimes and present as a true hemoptysis. Though there are very broad spectrum of reasons for hemoptysis, still TB is very common in India for it. Underlying pathologies in TB are bronchiectasis, aspergilloma, direct erosion of capillaries by inflammation, endobronchitis, bleeding from the wall of the TB cavity, rupture of the Rasmussen's aneurysm, production of broncholith, cavernolith or scar carcinoma. Here AKT is the key treatment for all of that. Many times some underlying pathology continue to be there after the completion of TB treatment also and hemoptysis persists. So these patients have to go through surgical procedures. History and examination provides good clues to reach the cause behind hemoptysis. Bronchoscopy is a useful tool for diagnosis as well as therapeutic interventions. But massive hemoptysis is an emergency and should be managed aggressively in the hospital only. So friends, that's all for today's video. Hope you enjoyed it and it will be helpful to manage your hemoptysis patients. Thank you so much. Please do share, like or comment on the video and subscribe to our channel. Till then, goodbye. Think less, do more and always be happy for being healthy.